Advocacy for improved healthcare access for the LGBT community. Introduction to the LGBT plus population. The definition, the LGBTQ plus population includes individuals who identify as lesbian, gay, bisexual, transgender, queer, or questioning with the plus, representing other sexual orientations and gender identities. Cultural aspects emphasizes on inclusivity, diversity, and self-expression. Pride in identity is central to the culture. Challenges that they face: discrimination in healthcare, lack of culturally competent care, stigma, mental health disparities. Resiliency factors: strong community support networks, advocacy movements, and growing acceptance in society have contributed to resilience and increased visibility. Historical marginalization and societal approach. In the historical context, the LGBTQ plus community has faced long-standing discrimination, criminalization of same-sex relationships, and lack of legal protections. The Stonewall riots of 1969 marked a turning point in the LGBTQ plus rights. Current societal approach. While legal advancements like marriage equality have been made, challenges remain, such as discriminatory healthcare policies and lack of transgender inclusive services. Societal policy impact on the local level, some cities have non-discrimination ordinance in healthcare, but progress varies. But progress varies. On the state level, states like California have passed inclusive laws, while others lack comprehensive healthcare protections for LGBTQ plus individuals, particularly transgender people. On the federal level, the Affordable Care Act, Section 1557, prohibits discrimination based on sexual orientation and gender identity, but enforcement varies and policies can shift with political changes. Advanced plan overview. One goal is to improve healthcare access for LGBTQ plus individuals by addressing discriminatory practices and promoting culturally competent care. The steps that would be taken are to collaborate with local LGBTQ plus organizations to identify gaps in healthcare services, advocate for policy change at the local and state levels to ensure legal protections, work with healthcare providers to offer culturally competent training, and launch community awareness campaigning on LGBTQ plus healthcare rights. Social media campaign. The objective is to raise awareness about healthcare disparities and promote action. The platform that would be used is through Facebook, Instagram, and Twitter. The key message is equal access, equal care for all, highlight healthcare inequalities faced by the LGBTQ plus community, and encourage followers to contact legislators to support non-discrimination policies. The call to action would be sign our petition for inclusive healthcare policies, or share your healthcare story to raise awareness. Survey questions and administration. The focus of the survey was to understand healthcare experiences and barriers among LGBTQ plus individuals. Key survey questions: have you faced discrimination in healthcare settings due to your social orientation or gender identity? Do you feel your healthcare provider is culturally competent in the LGBTQ plus issues? And what barriers prevent you from accessing healthcare services? Administration plan is to distribute the survey online via social media platforms, LGBTQ plus community centers, and healthcare clinics. Evaluation and survey results. Key findings were 75% of respondents reported experiencing discrimination in healthcare, while 60 indicated a lack of culturally competent care for providers. Mental health and transgender specific services were identified as significant unmet needs. Community needs: enhanced provider training, stronger level protections, and better access to mental health services emerge as top priorities. Evaluating the advocacy plan. Evaluation criteria, outcomes and measures. Increase in LGBTQ plus individuals accessing healthcare reduction in reports of discrimination, increased provider participation in cultural competency training, and some methods were regular face feedback from the community through surveys and focus groups, tracking changes in local and state policies, and partnering with LGBTQ plus organizations to monitor progress. Some references, the reference would be from advocacy evaluation methods emphasize using both qualitative and quantitative data to track changes over time. Lessons learned and barriers encountered. Lessons learned from this were building partnerships with LGBTQ plus organizations is key to understanding community needs. A multifaceted approach, including social media surveys and policy advocacy, is essential for access. Barriers encountered were resistance from some healthcare providers to undergo cultural competency training, difficulty in engaging certain certain segments of the LGBTQ plus community, such as older adults and rural residents in advocacy efforts, challenges in collecting reliable data due to fear of disclosure in surveys. And to conclude, advocacy efforts for the LGBTQ plus community must focus on addressing healthcare disparities through policy change, community engagement, and provider education. Continuous monitoring and community feedback are essential for sustained progress. The next steps would be to continue collaboration with local organizations and advocacy for state level non-discrimination policies in healthcare. Some references I've used were from Cohen L. De La Vega R. and Watson G. from their 2001 Advocacy for Social Justice, a Global Action and Reflection Guide. Another reference I used was Human Rights Campaign 2023 LGBTQ Healthcare Equality, and Cates L. and Ranju U 2020 Health and Access to Care and Coverage for LGBTQ plus individuals in the US. Kaiser Family Foundation.